Hi guys, welcome back to the channel. So we have completed with the epithelial origin odontogenic tumor, that is ameloblastoma, squamous odontogenic tumor, CEOT and AOT. Okay, ameloblastoma we have dealt in detail because it itself is a big topic and an important topic. We have dealt everything about ameloblastoma and we have dealt everything important about other epithelial origin odontogenic tumor. Okay, now today class will be starting with mixed odontogenic tumor. Okay, mixed odontogenic tumor means it has both epithelial and mesenchymal origin or epithelial or mesenchymal component. Okay, then we'll be starting, when we'll complete the mix, then we'll be starting with the mesenchymal origin tumor. Okay, so let's start today's class. Mixed odontogenic tumor, which means epithelial and mesenchymal origin. First tumor is ameloblastic fibroma. Okay, it is a hematomous proliferation of odontogenic epithelium of enamel organ and odontogenic mesenchyme resembling dental papilla. Okay, it can be a hematomous proliferation or it can act as a true neoplasm. It can be both. Okay, it can be a hematomous proliferation or it can be a true neoplasm. It is a hematomous proliferation of what? Odontogenic epithelium of enamel organ and odontogenic mesenchyme resembling dental papilla. So it has an epithelial component from the enamel organ and a mesenchymal component, okay, which resembles dental papilla. Okay, or it may behave either as a true neoplasm. Okay, it can also behave as a true benign neoplasm. So it can be hematomous proliferation or behave as a true neoplasm. It is a hematomous proliferation of mixed origin which have an odontogenic epithelium of enamel organ and odontogenic mesenchyme which resemble dental papilla. Okay, it represents an aborted attempt to tooth formation but prior to enamel or dentine formation. Okay, what it represent? It represent an aborted attempt at tooth formation. Okay, I'll tell you one thing. In mixed odontogenic tumor, we'll see the tumor which generally or usually or mostly the tumor coming under this category which will represent an aborted attempt to tooth formation. Okay, whichever tumor will be dealing in this category will represent an aborted attempt to tooth formation. It is an aborted attempt to tooth formation but prior to the enamel or dentine formation. मतलब dentine और enamel बनने से पहले. Okay, intermediate in this attempt, so there is presence of enamel and dentine. So the term will known as ameloblastic fibroodontoma. It will no more be fibroma, it will be fibroodontoma. If this process comes to an intermediate stage, मतलब जो aborted tooth formation हुआ है उसमें डेंटिन और इनामल भी बन गया है थोड़ा बहुत, so it is an not completely but थोड़ा बहुत, so it will be known as ameloblastic fibroodontoma, not ameloblastic fibroma. Okay, so sometimes it is also known as ameloblastic fibroodontoma, but it is an intermediate step. Okay, or intermediate in this attempt. Okay, when aborted attempt to tooth formation is going on. ठीक है, now what are the clinical features? So it is found mainly in young adult and children. Okay, young adult and children. So it is also a distinguishing feature. It is not in the mid age. It is mostly seen in young adult and children like AOT, but AOT is mostly common in women. There is no sex predilection in this tumor. Okay, now mean age is 6 to 12 years. Mean age is 6 to 12 years. Okay, so it is common in young adult and children. No sex predilection is there, but in AOT it is common in young adults or young patient, but more common in women. 2/3 of the, okay, we remember AOT is a 2/3 tumor. Okay, mid age is 6 to 12 years. Now there is no sex predilection. Sign of swelling, asymptomatic expansion of the jaw. Okay, there is asymptomatic expansion of the jaw. Failure of tooth eruption. Okay, the associated tooth will be not erupted. Pain, tenderness just starts from the side sometime. Posterior mandible is most common, and first and secondary primary molar is the common area. Obviously in young patients, so primary molar and posterior mandible is more common. Okay, the radiographic features, histopath and the treatment plan will be discussing in the next class. Okay, till then like, share, subscribe and comment. Bye.